This year I've chosen to promote a charity that is very close to my heart, or should I say my brain, the Intracranial Hypertension Research Foundation. Let me explain. Over this year, I have become one of the many people who suffers from a little-known disease called intracranial hypertension, more commonly known as pseudotumor cerebrae. Since the everyday struggles and frustrations of this disease are most easily described through the stories of those who fight it, I'm going to explain intracranial hypertension to you with the help of some fellow fighters. I'll begin with my story, which started earlier this year. I had been having weird visual spells off and on for a month. My vision would spin, lights would dance around in it. Sometimes it would just fade to black. When things like this happened, I would turn to my friends and inform them that I felt like I was going blind. Little did I know. Finally, I decided to have my eyes checked out. The ophthalmologist found a bulge in the back of my eye called papilledema. The doctor turned to me and tried to explain as calmly as possible why I had to go straight to the ER. Papilledema is caused by increased pressure in the brain, and I need to be tested to find that source. My story is not all that different from other pseudotumor patients. Sharon from Cincinnati woke up one morning seeing bloody handprints on her wall. When she went to the eye doctor, she was told it could either be pseudotumor cerebrae, MS, or a brain tumor. The stress of waiting for answers is often intense and insanely terrifying. For all we know, the doctors are about to tell us we're dying of some cancer. It is moments like this that define our characters. There are two tests that pretty much every pseudotumor patient experiences at least once in their life. The first is an MRI. Paula from New York had her MRI done at a local hospital. Rather than answer questions, the lack of masses or tumors in her brain just caused more confusion. What is causing the pressure in her brain? The second test that every pseudotumor patient knows, and many cringe at the thought of, is called a lumbar puncture, or spinal tap. In this painful procedure, a long needle takes spinal fluid from the spine of a patient by puncturing into the spinal column. This procedure measures fluid pressure and allows them to test the fluid for infection. It is at the end of these stressful tests that diagnosis finally comes. Pseudotumor cerebrae becomes a curse word, and a fact of life. The symptoms of pseudotumor are fairly wide. Sharon experiences the fairly less common hearing symptom associated with the disease, a whooshing sound in her ears that can become so intense it leaves her deaf at times. The most common symptom is headaches. These headaches are not your garden variety. They are severe and very hard to relieve. Since the cause of the headaches is intense pressure, all the painkillers can do is mask the pain. Heavy-duty painkillers taken for long periods of time can have many side effects. For me, the worst side effect is extreme nausea that will not be tamed unless the painkillers are taken away. For some, the constant struggle with vision eventually ends in blindness, when the optic nerves become too damaged to work properly anymore. It is extremely terrifying to watch your sight grow darker and darker each day, not knowing if the world will ever come back into the light. There aren't many ways that doctors can treat pseudotumor. Many patients, such as Paula and Sharon, are put on a medication called Diamox, some with doses as high as 3,000 milligrams. Some doctors stress losing weight and encourage their patients to lose any excess pounds in the hopes that their symptoms will lessen. The surgical procedure commonly associated with pseudotumor is the placement of a device called a shunt. This shunt relocates the spinal fluid to a new part of your body where it will be properly absorbed. Of course, none of the methods of treatments are exact, and every patient is different. As of now, the causes of pseudotumor are fairly unknown. Stereotypically, patients tend to be overweight females of childbearing age. However, this is not the case for everyone. Will is a male patient in Texas. He has had several lumbar punctures to relieve severe headaches, and his vision has taken a change for the worse. Paula is an overweight female, but at the age of 52 is well out of her childbearing years. Hannah, a 15-year-old girl from St. Louis, has been suffering from IH since she was 5 years old. Nicholas from Oklahoma is an 11-year-old boy. Obviously, some things are not adding up to the commonly accepted theory of who pseudotumor patients are. This is why the Intracranial Hypertension Research Foundation is so important to us. This foundation is actually trying to research and find answers for all of us pseudotumor patients. Eventually, we might have more accurate and less painful treatments. Maybe someday we can find the real causes of pseudotumor. In fact, maybe someday we can figure out what this disease really is. Our invisible disease is fairly unknown, but the struggles we face are life-altering. Please help us find the light in the darkness and donate to our cause. Together, we can make a difference.
There are times in my life that I think that I'm gone insane. Then I look to the sky, feel the wind in my hair. Thank God it's a stormy day. Let it rain, let it rain. Let the water run over me, clear my eyes, show me what I need to see. Let it rain, let it rain as I stand and cry. Let the water run over me, let it rain. Maybe it's you, or it might be me. Maybe it's all these things in life that I feel that you have to be. I wanna hold on to all that I got, but it's time to let it go. I've gotta look to the heavens for the power up above. Show me where I need to go. Let it rain, let it rain. Let the water run over me, clear my eyes, show me what I need to see. Let it rain, let it rain as I stand and cry. Let the water run over me, let it rain. Let the water